Hello, I hope you're doing fine. Welcome to our today's class where we are going to discuss about drowning. My name is Winnie Barawa. If you're new here, welcome. Join us, watch till the end. Remember to subscribe, comment, and share insights of which other topic you wish us to keep discussing. Before starting this session, I would like us to have a moment of silence for Wendy. Wendy is a nurse in Canada who died due to drowning in a swimming pool. Thank you very much for the moment of respect. May her soul rest in eternal peace. The nursing family and fraternity will greatly miss your skills. Introduction. So what is drowning? Drowning is a state where the victim inhales or ingests water through the respiratory tract or alimentary tract, meaning this is a state whereby a person can either breathe in too much water into the system or take in or drink in excess of water into the digestive system. There are certain factors that can put one at risk of drowning, and this includes use of drug and substance abuse, for example, alcohol, state of poor swimming skills, panic sessions, severe traumatic injuries, fatigue or exhaustion, suicidal attempts, seizure near water bodies or near water pool. Someone can also fall during a boat ride or also boating activities. Types of drowning, and we will discuss two of these. One of it is what we call the wet drowning. In wet drowning, the water enters the lungs and ends up affecting the exchange of gases in the system. As a result, the breathing and the circulation function is impaired. Then we have the dry drowning, where water does not enter the lungs due to spasms in the upper airways. However, the air entry to the lower airways is blocked, of course due to the blockage that has happened in the upper airways. So what signs and symptoms that we should know about drowning? Number one, on observation, our patient will be presenting with abdominal distension. The client will present with chest pains. There will be bluish coloration on the extremities, that is on the feet and in the hands. And on the face, we will observe some signs of bluishness on the lips and also in the tongue. There will be cold skin, either on the skin itself or in the extremities. The patient can display signs of irritability and restlessness, signs of lethargy, difficult in breathing, and in most of the cases you will observe unconsciousness for the patient. Signs that we've just discussed about, they take place when you're talking about a wet drowning, but I want us to look at these drowning cases in a state whereby you are observing, but again you have good knowledge of drowning and you are able to tell from afar that a client could be going through drowning. So what do you observe? When you observe here, one of it that you will see is that the face will be facing towards the shore, whereby it shows you the client is trying to find help or run towards a safe zone. Number two, the mouth will be at a water level. Reason being, most of the time you want to stay above the water so that you don't choke or you don't ingest a lot of that water. The head will also be tilted backwards and the body will be looking vertical because they want to achieve a standing position so that they don't fall back. However, when you observe properly, the body will be in a climbing ladder motion as a sign that the patient is trying to save themselves. In other instances, you will observe that the patient will be batting around in the water as if they're trying to have maneuvers to keep themselves afloat. Others might be screaming and asking for help. So when you observe such a scenario, then we advise that immediately start calling for help. So number one, in the first aid management of a drowning case, you are supposed to establish safety first. So how do you establish safety? You are being told, do not jump in. Instead, Help remove the victim from water by throwing in either an object, a rope, or anything that you can help to pull the patient out. However, if you're a good swimmer, you are advised to jump in but rescue the patient under water. Call for help, that is, if it's available near you or if there are any other people that are able to observe the same case. And if you have telephone numbers, call and notify the emergency team. But after you have successfully removed your patient from the water, position the victim in a proper position. So put the victim on their back, a position that we call supine position. Then tilt their head, a maneuver that we call the head tilt maneuver. Then lift the chin, what we call the chin lift. All these are going to help us open the airways. Then in such a manner, remove wet clothes and keep your patient warm. How do you achieve chin lift and head tilt maneuvers? So in our photo here, we have a display of how to achieve this. For the chin lift, you place your hand below the chin and push it a little bit upward as if in an inclined position or at an angle. Then your other hand will be at the head and trying to pull it backwards a little bit. You have achieved the proper position. You have done chin lift. You have done the head lift. Next is to assess this patient. How do you assess? Observe, listen, and feel. So observe for any state of alertness, consciousness, and orientation. Also check for the chest movements to ascertain if your client is breathing. Listen. So if you have your stethoscopes, you can use it to listen to the heart and the lung sound. Unfortunately, most of the time, these cases catch us unawares and we may not have this equipment. So the safest way to do is to feel. So you can use either your back of your hand, what we call dorsum of the hand, or you can place your ear next to your patient's mouth and nose and feel for air. If the patient is not breathing, please check for the pulse. If there is no pulse, then start what we call CPR, and this is cardiopulmonary resuscitation. So what is cardiopulmonary resuscitation? CPR, as you perform it, it will depend on either you're performing it on an adult or you're performing it on a child. If you're performing on an adult, it's advised that you start with 30 chest compressions, then 2 rescue breath. Doing it on a child or a baby, you start with 5 rescue breath, then 30 compressions, and then you go back to 2 breaths. Continue doing that hard, fast, and keep going until you realize that your patient is achieving some state of consciousness, as you keep observing if your patient is responding and acquiring some warmth. So if you start to observe that your patient is regaining consciousness, you are swiftly advised to put your patient in the recovery position, as you keep checking for breathing and ensuring that your patient does not choke on any water regurgitation. While you're performing all this, keep checking on your emergency services. Call and reaffirm that they are coming. So how is the recovery position achieved? The recovery position is also known as the left lateral position. And as you can observe, your patient is sleeping on a side way on the left side. So I want us to note a few things. On this position, the hand is put under the chin to keep the mouth open. Remember, some client will be having water retention, and this position will help them release that fluid out. The arm is also bent to prevent rolling over, and the legs on the other side are also bent to support the body, or to provide support and to prevent any rolling over. Now that we are having rising cases of drowning, both in shallow pools and in deep pools, it's good we have preventive measures to keep safe. So one of it is first the pool, then supervise kids or mates when they're swimming. Use flotation devices, what we also call assistive devices. Then learn how to resuscitate, as you never know when you might need those skills or apply them. Then learn the proper swimming techniques to keep safe. Thank you very much. Remember to share, subscribe, and comment in our session. says, keep safe till we meet again. Bye bye.